Assalamu alaikum everybody. Thank you very much for coming after your such a busy day. Before I start, I would like to extend my thanks to Allah and to Dr. Abdul Rahman in creating this idea of making a new way of learning and transferring the information between healthcare staff. And I also thanks to him because this slides and everything prepared by him. I'm only one speaking about it. So thank you, Dr. Abdul Rahman. So what happens is, as you know that there are so many things in the quality management. So what we take questions, these questions are having a very important definitions, and these definitions are asked by the surveyors. For example, the first question here is RCA. What is this? It's a root cause analysis. And just one or two sentences why we do this. To know the cause. What are the tools we use for this? We use Ishikawa chart or fishbone chart. This is the easiest way to do the RCA. And we do have a separate RCA form which is very in detail for certain special cases of sentinel events or any mortality cases, we go for them. So for RCA, you can remember it's one of the tools to check what is the cause of that event. Maybe it's a minor event or a bigger event, but RCA is used. The second question is PDCA. Everybody knows about PDCA. It's a plan, do, act, and check. It is one of the improvement methodology used right from 100 years almost now. They're using this. They're using for $10 up to $10 million. The same program they are using it. It's a very proven methodology for improvement. CSSD, this is Central Supply Sterilization Department. OVR, Occurrence Variance Report. Occurrence Variance Report, I think everybody is aware about it. This Occurrence Variance Report is what? It is one of the tools to improve again. Whenever there are occurrences which are not complying the policy, we write an OVR. And OVR is not a complaint, it's just an information you are providing to the management that something is wrong according to the policy. And there is an area of improvement we needed to focus on it. So this will help us to focus on area of improvement. PPE, this is very well known because Dr. Ibrahim is working very hard and his team is working very hard on the infection control. PPE is nothing but the personal protective equipments. What are the types of indicators? There are three kinds of indicators: structure, process, and outcome. There is fourth one which we are going to add, that is called the balanced. Balance means if there is something improving, so we have to look into that. Because of this improvement, there is other area is affected or no. Because sometimes what happens, we focus on something and we leave something. So the fourth one which we are going to add for this year is balance. What is quality? Doing the right thing, the right way in the first time and doing the better the next. This definition is a very primary definition. It's a very good one, still workable. International patient safety goals. There are 6 international patient safety goals. These safety goals are well known throughout the world. It is internationally accepted from the WHO, ARHQ, IHI, whatever the organizations are working in the world, they are using this. What is that? Identify patients correctly. We are using 2 patient identifiers. What is that?
Medical record number and the patient full name.
Patient's full name. So I'm sure my nurses and everybody now, they are writing 4 names, whatever coming. Because of now IT, it is very easy now. The name is coming very correctly. The file number is coming very correctly. There is no discrepancies going in there. And especially, you have to use this when you are doing any procedures. Any procedure. Giving medications, drawing the blood. Whenever the patient is handoff from one place to another place, whenever you are doing this handoff, you have to use correct patient identification. And again, when we are using telephone order or what else? Verbal order, no need. Telephone order especially. Reporting the panic values. So at that time, you have to use this patient identification. Second is improving communication among the healthcare staff. Yes. For that reason, according to this new edition, we have a policy that is called a handoff policy. This is between one doctor to another doctor, one shift to another shift, nurses to nurses, even if they are transferring patient from inside the hospital, from ER to the ward, or from hospital to another hospital. So this is handoff. We have a complete project, and inshallah in detail we will do it that one. Improving the safety of high alert medication. As you know that we have classified, there are medications which are known as high alert medication. Why they are high alert medication? Because their therapeutic index is very narrow. If it is given in a wrong dose or anything, there will be a disaster. Like all electrolytes, concentrated IV fluid, insulin, and there are some medicines which are look-alike also. So we have to keep that in a separate shelf, locked with a double lock. So whenever the nurses are using this high alert medication, they have to take certain precautions. While dispensing, the pharmacist will take, while administration, the nurses has to take, and again, while prescribing, the doctor has to take precaution on these high alert medications. Eliminating wrong site, wrong patient, wrong procedure surgeries. This is very well done in our hospital. We are doing it very good. We have a WHO protocol, and we are using this surgical safety checklist, and thanks to Dr. Shadi and the surgical team, they are doing very good job in that. And this is one of the essential safety requirement from the Sabahi new edition. Next comes to reduce the risk of healthcare acquired infection. And alhamdulillah, this is very well done, and you know that whenever the ministry is coming to our hospitals, nowadays they will come 2 days, not 1 day. They are coming 2 days, they are auditing files, auditing personal files, auditing all the processes, discussing with the staff, and mashallah, we got very high score. We are doing very good in that. Reduce the risk of patient harm resulting from the fall. Usually this is done for long-term care or the old age patient, but still we are having these issues in our hospital. Like example, if we have given sedation to the patient is post-operative and he wants to go for a bathroom, he is still in the medication effect. So what is to be done? How you are protecting the patient? For example, you are taking the patient to the X-ray room. Patient is on the X-ray table. So that time also how the babies, old age. So all that precautions, we have a policies on that. We have forms. We do the assessment at the initial when the patient is getting admitted. Post-operatively, again the nursing assessment is done. And at the discharge also we give instruction to the patient to avoid fall. So alhamdulillah, this job is very well done in our hospital. Patient had the incompatible blood transfusion, but no harm happened. This is defined as near miss, sentinel event, or regular incident. Yes. We will consider this even because it's a near miss, but this near miss is considered as a sentinel event. Define the following. Near miss. Near miss is very easy to remember. It's an unplanned event that did not result in an injury, illness or damage, but had the potential to do so. It means in a short term, in a short way, the mistake was about to happen, but didn't happen. So this is a near miss. Another one is sentinel event. Here the sentinel event means there is a definite psychological, physical trauma to the patient. Inevitable. This is very important. Thank you very much.
Thank you.
And I really appreciate all the participants using their time and efforts to writing the answers. And now the floor goes